Good afternoon, everyone. Welcome to one of MSF webinars. And today, our session called Climate Change, Is It a Health Emergency? And for this conversation, we have with us Dr. Monica Rull, the Medical Director of Doctor Without Borders Switzerland Operational Section. And I'm Ola Al-Ghazawy, the founder of PlanetX and a science journalist. And what makes us do this session that Doctors Without Borders Operational Center in Geneva, Switzerland, pledged to reduce emissions by at least 50% compared to 2019 by 2030. And in my opinion, this is very ambitious, but we will know how you are going to do this, Dr. Monica.
Hi, thank you very much for the opportunity to discuss this topic. Yeah, it's a very ambitious goal, but we think that either we are ambitious and then we move forward, and we can always justify why we don't reach that goal, than put a very modest ambition and then later be rewarded because we are just achieving something that is not making a big change.
Okay, so how are you exactly? Are you willing, or what is your plan to do that?
Yeah. So first of all, we are trying to get our baseline. As you were mentioning, our ambition is to reduce 50% emissions in 2030, and we are now putting in place a process to actually know which is our footprint today, but based on 2019 activities, because that was pre-COVID, so is a good parameter for us. With this in mind, we are doing a roadmap. We engage with an external organization as well to help us, because we are a medical humanitarian organization, not an expert in climate science, and we think that we need external assistance to help us in this road. What we are trying to do now is that we already identify a couple of things that we can do in the very short term. We know that part of our carbon footprint is related to supply and movements of goods. So we are targeting both in terms of identifying manufacturers and production that is more environmentally friendly, and as well shifting from air transport to transport by boat. That is much more, it's less damaging for environment. So that's one of the first things that we are trying to do. In addition to that, we are a medical organization. So we are reviewing our medical practices, the use of single-use items in medical activities, and seeing how we can safely keep on treating patients in a timely manner, but at the same time being much more ecologically friendly.
Some people would actually ask why, just like you said, you're a medical humanitarian organization, why you think that health could be some sort of a reason for climate change, and what brings two together. So can you tell us more about that?
Sure, with pleasure. As a medical practitioners, we know that the health of the people is not only the absence of disease, but also is very much impacted by the environment they live on. The climate emergency, the loss of the biodiversity, the environmental degradation, the climate change, and increased temperatures are having today an impact in health and will have an impact on health in the future. For example, we have infectious diseases that they are transmitted by vectors. Vectors are living organisms that transfer a disease from one place to another. For example, malaria, that is transmitted by a vector that is a mosquito. A mosquito requires climate conditions, weather conditions in the short term, but also humidity, temperature to survive and to thrive. With increased temperatures, with increasing rainfall, with changes on humidity, we can find mosquitoes where they were not there before. Therefore, we can find the disease in humans was not there before. In non-infectious diseases, we have, for example, heat waves. So very high temperatures that affect mainly the most vulnerable, either small children, elderly, or chronically ill people. So if you have, for example, a weak heart, if you are exposed to an extreme temperature, the risk of dying is high. So we see that as well, for example, for water-related diseases, such as cholera or other diarrheal diseases. When you change the temperature of the water, when you have no water in some places or not clean water, you increase the risk of having water-related conditions or diarrheas. And on top of that, we know that the changes in the environment will have either droughts, floods, it will rise sea levels, it will have an impact on agriculture, it will have an impact on food security. So it's multifactorial. We cannot say that climate change, and we are not saying that is the only reason for ill health, but we know that there are some health conditions and diseases that are very much in link with the environment and the changes in the environment.
So I think you have worked with many refugees camps in your field missions, and have you seen the impact of climate change on the condition or the health condition of the refugees in these camps? Have you witnessed some changes over the years?
It's very difficult to find a direct link, but what we are seeing in some of the areas where the refugees are settled is that we are seeing longer droughts or longer rainy seasons, and therefore they have an impact on the health of the refugees, but as well of the local community that is settled around the refugees. The specific case of refugees is that usually they are fully dependent on external aid, and their coping mechanisms are very limited. So if you have a picture of a refugee camp that is people living in under tents, most likely they are not in shelter that they are durable, or they are not in well isolated houses. So when you have increased rain, they are much more affected than the local communities. And if you have, for example, extreme heat, when you are living in a shelter that is not isolated, so the risk for the highly vulnerable increases.
Some people, for example, in the MENA region, the Middle East and North Africa, they think of climate change as the first world problems, not just our problems, and we have many other pressing issues at the moment. So how do you think, or how do you see that climate change is pressing an urgent crisis that we are dealing with? Have you seen something here in the region that says it's not a luxury to deal with climate change and its repercussions?
There is a loss of biodiversity and degradation of the environment that you can see in daily basis. Then climate change is the increase of temperatures, and it's in the long term, but we are seeing it today. The MENA region is one of the regions that is categorized by WHO as the second region more affected by the changes in the climate after the African region. So maybe it's not that obvious today, but it's something that we have to be ready to respond in the near future. So I know that there are already some changes, mainly in Egypt, that has been seen as the rising sea levels, acidity of water that are having already an impact on the ability of cultivation, which that can in turn also have an impact in food security. Therefore, it's something that is quite real for everyone. It's not only affecting the North Pole, and it's not something that it's only a concern for high-income countries. I mean, it's something that it's going to affect all of us in many locations. In particular, in the MENA region, you have as well, there are as well many deserts. And the deserts and the desertification is going to amplify the effects of the climate change in many areas. And in some areas, the rising temperatures will make the living in there not possible anymore. because no one can survive very high temperatures and thrive.
So back to the pledge that Doctors Without Borders has made. So why now? Because climate change has been there for like some time. So why you decided to do that now, and um, how will you roll your plan? Because I know that this is for Geneva only. How you will do that? Will you do that very soon enough for the other countries?
Yeah, well, why now? Because we are, as many parts of society, we are too late. The alarm was raised decades ago, and we were, as a medical humanitarian organization, we were very focused in saving lives. We were very focused in responding to emergencies, and this was a little bit like in the MENA region, not high in our agenda. But we now are trying to catching up. Just as an information, the pledge for the 50% reduction is an OCG, and a Swiss pledge, but the MSF as whole is very concerned, and we have already an environmental pact that it's every section in MSF is working towards reducing our footprint and being much more environmentally friendly in our way of implementing. What we are doing now, as I mentioned before, is trying to find what are the short-term solutions that we can put in place that will contribute to that massive reduction, such as investing more in renewable energy, thinking about our providers and their practices in production, moving forward with quick changing from flight cargo to sail by sea, by boat. Doing as well, I mean, we are in many countries, so not all the countries can do the same things at the same time. So we are trying to put together a roadmap, and at the same time that we are doing punctual actions, wherever we see that there is an opportunity, we seize it. We are trying to be much more structured to see how we can achieve that 50% reduction by 2030 by scaling up actions that we are trying in small pilots.
I can see how passionate you are about talking about this topic, and it makes me wonder, because I know you have a medical background, and I think most of people working at Doctors Without Borders. So why actually you are interested in such an action?
Well, because I'm a doctor, so by heart I try to cure people and prevent disease. That's what we do as a medical practitioners, no? Not trying only to cure people, but also to make actions to avoid people falling sick. So, and in the other hand, I think it's very important for a medical practitioner not to solve a health problem of today by creating a potential problem tomorrow. So it's the do not harm policy that we have as a medical professionals is not just for the patient today, but also expand to their families and communities. So that's why I think in MSF we are passionate in targeting and in doing actions from our side to not be part of the problem, but become part of the solution.
I love the idea you just said, that it's part of your work as a doctor to make people's life a better one, just not by creating more. It's a tomorrow's doctor problem, not mine, just like some people says. But some people actually forget this sometimes and just focus on what they have right here and right now without thinking of the consequences of their actions. For example, I was talking with you in the preparatory session about how the what they call it. I totally forgot.
Personal protection equipment.
Yes, exactly, the one that we one use, and how this actually contributed to pollution. And we saw a lot of pictures of medical masks in the sea, and how it affects the marine life. And can you tell us a little bit about this topic, and how a good and responsible action from the doctors can help in solving this issue?
Yeah, I think that as taking the word from someone from the logistics department in energy, the best waste is the waste you don't generate. That's the best waste. While you have to generate, because also you need to protect patients and health providers, the very least that you can do is to be responsible with the management of that waste. In MSF, we are trying to set high standards for managing single-use items, and provided the different conditions in the field to go for industrialized waste management. That means we can burn material in a safe way, even the single use. And in parallel on that, we are trying to find alternative solutions when suitable and when possible to the single use. So we are launching as well some research to see which type of materials we could use that it can be reutilized in a safe way. On top of that, we are reviewing our medical practice and trying to reduce as much as possible the use of single-use material. There are several experiences in hospitals saying that good hand hygiene is equal to use gloves. In many health actions, you don't need to wear gloves if you have a good hand hygiene. So these are the type of things that can have, if you add all of them, if you have 71 projects that they are generating gloves and you can reduce drastically the consumption, we will have an impact on waste generation.
So again, another point in our preparatory session, and we were talking about that you started to see some diseases like coming back because of the climate change in Yemen and other parts of the world. And I want to know from you more, how did you find that and how we can fight this in the future? And give us some examples from the field, from the reality.
Yeah. So what we are seeing now, for example, is malaria, what I was mentioning before. Malaria is transmitted from a mosquito that for many years was not seen or couldn't survive to certain altitude or temperatures. And now we are seeing malaria in areas where malaria was not there before. We are seeing more in Africa than in the MENA region. But that's something we need to keep an eye on. The other diseases that they are, the waterborne diseases that they are very much environmentally sensitive or climate sensitive. One of them is cholera, for example. Cholera can survive, is a microorganism that requires certain temperature and conditions in the water to survive. And we are seeing cholera in places where cholera was not there before. And we are seeing big epidemic of cholera, for example, in the Middle East, in Yemen. We have seen it in the past. That it cannot only be related to the climate, it's also related to the infrastructure, to the water scarcity, but it's something that adds to the problematic. And the other one that it's very, I don't know if the audience is familiar with, there one mosquito that is called the Aedes, that is a cousin of the mosquito of the malaria, that has been spreading widely worldwide. And there are some viral diseases such as dengue, Zika. If you remember, there was a couple of years ago some big expansion of Zika disease and dengue and chikungunya, that they are diseases, that they are viral diseases, that they were not very well known in many parts of the world, and now that have been reported. And they are and they have a heavy weight and a heavy cost in health.
I think that there is another aspect of climate change that affecting your work, and correct me if I'm wrong, that sometimes it's hard for you to reach out for a crisis area because of a flood or a natural disaster, and it's done by the climate change. Have you faced something like that before?
What we can see now, as mentioned before, is we can see in certain areas that are climate hotspots, such as in Niger, that the rainy season, it's coming early and it's longer. So, and there are torrential floods, torrential rains with floods. And then the malaria season gets a little bit earlier and longer For example, that we can see. We have seen droughts, and last year, for example, in 2019, we responded to 2 cyclones back to back in Mozambique. In last year, we responded in Honduras to 2 cyclones, and the severity of the cyclone was higher than expected. So we are seeing that with the climate change, one of the consequences is severe weather events, what is called, that goes from cyclones to severe droughts to severe floods. And we are seeing some of those happening today.
So it's not just about creating more disease that makes it burden for you to handle, but it makes it harder, even harder for you to reach out for people, I think. So we were talking about heat stress and how the elevated temperature that that creating a huge health crisis around the world. How this affected your work, and how did you see some of these stuff before?
In our projects, not in OCG projects, not. We had some lessons learned from other sections on heat waves in Pakistan, for example. The problem with a heat wave is that it's well known that increased temperatures for people that has a weak health, mainly the elderly, the very young, or the people with chronic conditions, they have more difficulty to cope. The problem as well is monitoring where is happening and what are the consequences, because again, that affects very elderly people or very young people, and it can be masqueraded by other conditions or other diseases. But that's something we need to monitor carefully, because it's very sensitive for the most vulnerable, in fact, the sick, the small, and the elderly.
I think it's very responsible of the Doctor Without Borders to take this action, even if, as we all say, that we always say that late better than never, because health sector is one of the most polluting sectors in the industry. So how are you? You said that you have that company that will help you do the plan and go ahead, but the responsibility of every and each employee, just like yourself, how Doctor Without Borders are like spreading the message between its employees, for example.
Yeah, now that's a very, very good point, because it's a culture change. We need to sensitize people. People need to understand the problematic, and we need to change practices that they are very much ingrained in our day-to-day. Yeah. So what we are doing now is we are, first of all, this type of events helps to spread the words. We are working in learning and development, in training modules, in sensitizing our staff. And that's why we need some external support to make sure that the messaging is clear, that and that we roll out that towards all our staff that is deployed. We have a very significant health workforce. So if every individual that is working with MSF is sensitized at least and knows the problematic, it also will help us to move forward with initiatives that may make the work a little bit more complicated, or that it may imply that we need to change some of the ways we are working. We were discussing the other day, I think that massive impact on the climate change will not come from medical humanitarian organizations like MSF. It needs political willingness, and it needs countries to be much more strict in their policies and their practices. But if we can all contribute with that, we will make an addition to the effort. So we can all do something. We can all do wonder ourselves if we need to leave that light open, if we need that air condition, if I need to take the car, or if I can walk or use a bike. But that's an individual action that will contribute. But what is important is the collective, if we want to have a shorter term impact in the big scheme on the impact on the planet.
So as a non-for-profit organization, and you are correct me if I'm wrong, you are supported by donations from people. Aren't you afraid that people just like, why you are using this money for climate change action? Or what do you think? Do you need more money to do the climate action part, cutting the emissions?
That's what we are trying to sort it out now, seeing which are the actions we have to implement and expand and roll out. Yes, being environmentally friendly sometimes comes with a cost. So having a good incinerator with good fume control is more expensive than your burner that you put in a corner. So you need to do some investments in infrastructure to improve. It's the same changing from fuel to solar panels. You need an investment, and again, it's not always the only solution. You need to find hybrid solutions for everything. We are concerned that we will lose the donors or support. Not really. I think that people is more and more aware that we need to keep on saving lives, but we need to do it in a way that will preserve the life in the future. And if we explain very clearly, and let's be clear, we are not going to become an environmental organization per se. Our focus still is to save lives and to be a medical humanitarian and health humanitarian organization. So we are going to maintain our reactivity in emergencies. We are not going to say, okay, we are going by boat when it's a massive emergency. We will keep on taking flights. But between becoming, jeopardizing the rapidity or the speed of intervention and do it in a way that it's more environmentally conscious, there is a big room for improvement for a medical humanitarian actor. And what we are trying to do now is that don't lose our focus of our social mission, that is saving lives and responding to emergencies, but at the same time adding a green lens to that to say, can we do it in a way that it's better? And what do we need to invest on that for doing it better?
And actually, you may be investing in the infrastructure right now, but I think the outcome will actually lower the cost in a way or another. Just like the example you gave about the gas and the hybrid car or the electrical car, it's more clean and it's even cheaper in the future. But it's like pricey now. So I think you have to do. You have to balance everything after all. So for how long have you been working for Doctors Without Borders?
Ooh, I'm going to sound very old. I think already 20 years. Around
So
20 years.
after 20 years, have you seen like changes like this one, like taking an action and taking and be responsible for the climate? Have you seen how you think that culture of the organization have changed through the 50 years and or the time you have served in Doctors Without Borders?
I think MSF has always been very committed to the emergency or to the environment where we are living. I mean, we were also very ambitious when we started with HIV/TB, for example. We started treating patients when we were not sure what was the best solution or how we could do it when the cost was super high and people were saying that that's not sustainable in the long term. Are you sure you want to go there? The same for getting medical innovation and better practices in the field. So I think it's in the spirit of MSF to challenge ourselves in regular basis and to confront ourselves with the big challenges of the century. And I think that the climate emergency is the big change and the big challenge that we need to face, and we need to be responsible. And as you say in the beginning, we are a little bit late, but we are of the opinion that it's better today than tomorrow. And yesterday would have been better, but at least let's not delay it more and just start targeting it.
So how do you think, because you said that climate change action and taking responsibility for reducing your emission, how do you think this will help the people actually Doctor Without Borders are trying to help? the people you are helping in the missions you are doing? How by cutting emissions that you are helping them in a way?
Well, as we were saying, if we cut emissions, we don't contribute to the climate change, at least not in a significant way. Therefore, we are protecting them. We can compare this with a vaccination campaign or a preventive package in the medical field. So by not by acting today, you are preventing the disease of tomorrow. So we see it a little bit in medical terms as a preventive activity that we are trying to do. And in the second hand, we are already assessing, investigating which are the adaptations we need to do to our actions, to one, be aware what are the consequences that we can be seeing today and we are passing by and not seeing them, and therefore how we need to operationalize as well indirect assistance to the people that is actually maybe suffering and seeing the consequences in health of the climate emergency.
So what if you have succeeded in cutting your emissions by 50% by 2030? What do you think is the proper steps after that? What you should do?
Cutting is 70%, 80%. I mean, it's 10 years in time. I think our roadmap will also guide us on that. I mean, we need to reduce, and 50% is a minimal reduction. I mean, if we really want to reverse some of the effects, we need to be more ambitious as a collective, as humanity, because the main thing of the climate emergency and the climate change is that it's more and more clear that it's man-made. Mostly. So let's see on the road what we will, how can we keep on the ambition of keep on reducing our footprint. You're mute.
One in the comments were asking when we were talking about the disposal gadgets for protection, like the medical masks and stuff, and he said, "What do you mean? Do you mean that we don't wear masks?" And no.
No. Sorry for the misunderstanding. There are some protective materials such as gloves that they are not necessary always. And there are some protective materials as masks that they are not necessarily needed always in the medical practice. When we are discussing protective materials within the COVID pandemic, that's another discussion. That's a discussion of saying there are some masks that they are for different levels of protection, either yourself or others. And those masks can be reusable and we don't need surgical masks, that they are more difficult to dispose afterwards. And within the medical field, we are exploring the possibilities of using reusable masks with the same protection efforts. So I'm not saying don't use a mask, not at all. I'm saying we are assessing where do we need to use a mask, and is there an alternative to a single use? And if so, then let's promote it. You're mute again.
I always forget to unmute myself. Sorry for that. So we have Dan, and he asking, it's not clear it's man-made, that it's just speculation. I think I will assume that you mean that climate change is not man-made, or it's proven that it's not it's man-made. We have done this to the earth, and I think it's our responsibility to clean our mess. What do you think, Monica?
I think there is a more and more body of science that is proving that the rising temperatures and the climate change has the humans and human action has a very important role to play, and that is by far now we are entering in what is called the Anthropocene. That is the climate change has been recurrent in Earth since the beginning of Earth. That's clear. But what we are seeing now is an acceleration of it by the human action. You're mute again.
So Dan has more comments about the gadgets using to protect on COVID, and he said, okay, never, okay, paper or watch it, full protection against agents such as COVID means not just masks, means gloves, goggles, and suits as well. But we are talking about the disposable means, that like the full suits, the disposable one, and we were talking about and I think Monica just made it clear that we need just to know when to wear what, right, Monica?
Yeah, I think we need to. We don't. Need, I think that extremes are never good. We need to keep in mind which is the objective of an action and what are the environment of that action. Again, if you are in an ICU with COVID patients, that you are doing actions that are aerosol generation, you need a full proof to protect yourself. That's not a question. This said, is that foolproof need to be always single use, or can we ask for alternatives? So far, we don't have, but we may have in the future. And the other thing is, for normal medical practice, we got used, for many good reasons, to single use as being the gold standard. And now I think we need to go back, sit and think, okay, maybe not always is the golden standard. Maybe there are some occasions where either we don't need it, or we can think in alternative uses. I hope that clarified.
Yeah, I think this is the point about, because some people are overusing this stuff. It's like, I'm just going to do something, I will wear everything, and I will just like dispose it, and it's just a waste. So we have a question about the status of COVID in Yemen. I don't know if you have something to say about that, Monica, because it's out of the scope, but would you like to comment on that?
I don't have, I'm sorry, I just came back from holiday, so I don't have the information, but I can look for it, and if you want, we can do an exchange later on.
Yeah.
I'm sorry, I'm not up to date.
So some other comments about, okay, yes, she's talking about PPE for sure with COVID things. This is RS, there's no name, just things worst in terms of trying to be environmentally aware, but you can always try to reuse some items like face shields and goggles when you disinfect properly, minding IBC measure. Thank you for clarifying. And do we have other comments about this topic? Okay, so back to our topic about the climate action that MSF. Do you have other, because it's a very huge, I think, project to do, and there's a lot of details. Do you have something in mind that you would like people to know about this action and this step from Doctors Without Borders?
I think that I would like to thank, because this change also comes from the people that is working with us. There is a new generation of MSFers that they are very much environmentally conscious. So also what you were mentioning before, that it's also triggered by people that it's in the field and saying, okay, listen, we can do things differently. So that we are trying, that we are committed, and that we are committed to acknowledge successes and not such successes, and learn from our mistakes. So but that we need some time. I mean, we are a massive organization. We have been working in a certain ways for a while. So we are investing resources. We are partnering with people that are much more advanced than us and that tried things in the past. But it will take us some time. So also a word of caution of saying, no, it's not that next year suddenly MSF is gonna be totally different and we can bear results in 12 months, but that we are committed and we are consistent, and that we will that we will deliver, and I'm sure we will deliver as usual beyond what we expected that we could deliver.
And I think this action is actually a very thoughtful participation from Doctors Without Borders for the climate change action. And what do you think other healthcare organizations should do?
Well, as I say, there is a lot going on in the health field. I mean, from high-income countries changing policies and being very much aware of the impact they have, to small organizations or private practitioners that they are doing their best to minimize the waste generation and to be more environmentally friendly. And shift from fuel to solar, and think what else we can do to work on that. I think the key issue for the health sector is the plastic generation. That's one thing, and as well to look for the source, because while transport is the 30% of the emissions, 70% is generation of the product itself, from the extraction to the pharma, to the final pharma product that we are using. So I think we are learning from each other. There are many initiatives. We are in contact with the Health Without Harm and Green Hospital network. So there is many interesting things out there that we are trying to pull together and learn from each other.
We have a question from Delisha Shalji. How can countries with underdeveloped public health systems take steps within their capacity to fight climate change?
I think that one of the single things that we have seen in high-income countries is, for example, I go back to the gloves, but it's very obvious one. The overuse of protective material generates a lot of waste, and that lot of waste can be avoided if even in the more remote areas there is a good hand hygiene and proper IPC measures. So I think that reviewing the medical practices and the health practices is something that can be done regardless of the resources of the country and on the same time, as you were saying, Ola, if we reduce the use of single use, we need to order less. Therefore, it's also a gain that you can invest somewhere else in reinforcing the health system. So there are some issues that can be done. And for low resource settings, I know that there are alternatives to fuel that it can be done. And we have seen very interesting initiatives in refugee camps as to biocomposting. And that can generate income for hospitals. So there are many things that can be done. It's not necessary big investments which will make the difference.
And we have another question from Gabriella Pianchi. Has Doctor Without Borders witnessed directly the impact of climate change on health? Is there internal research done about that?
We are, again, it's very difficult to make a direct link between conditions we see and the climate change. Because if we take, for example, malnutrition is multifactorial. So what we can see is we can see the environment, and then we can see that the climate or the weather conditions have an impact. What we are trying to do now is put research to respond to some of those questions. Can we make the link? Can we not? Can we foresee, for example, for malaria? Can we see? Can we monitor environmental changes and then review if there is going to be a malaria peak or not? These type of things are ongoing in MSF in different fields, and yes, we hope we will have answers in the future.
Actually, I have a comment from I think Doctor Without Borders employee Alaf Hussein. an MSF Pakistan mission, we converted from generator power to solar renewable energy, which also contributes in climate change. This is a really good step, I think. And I think small steps. You don't need like an eruption in the whole operation to do such change. It's like small steps, and you'll be there in some time. So, any other comments? I see a lot of people are watching us from Nigeria and Kamranjir. So I would like actually to share one thing. I don't know if you want to share it with the audience or not. The picture we were talking about before, because this is actually a very, very nice picture. And I would love, because just like you said, it's because people sometimes forget why they started in the beginning. So this is a very lovely one. Can you tell us the story behind it? Because this is a very important thing you said, Monica, that people sometimes forget why they started and why they should continue.
Yeah, thank you for that. Well, that's a picture taken in Somalia. The little guy was severely malnourished with tuberculosis, and I keep it in my living room because it reminds me why I'm with MSF, and it's the smile of the child. It's not when they are sick, is when you see them, that they are playing with bubbles and that they are forgetting that they're in a hospital, and that's where we work. That's why we are MSF.
Exactly, because I think with all what you are seeing with cruelty and disease and illness and everything, I think it's overwhelming. But these moments, that I think what keeps people going in such a mission like the one you are doing. So while we were watching the picture, we got another question, and I think this is will be our last one. Would MSF ever turn this into a global advocacy campaign where they try to bring more awareness? Because at the end of the day, this affects the medical situation and consequently the aid you provide. And of course, in a crisis situation, Doctor Without Border will have to, but I can see the rest. Would have I can read it from here. The aid you provide, and of course, in a crisis situation, Doctor Without Border would have to put more resources into their missions, as more and more people would need more aid and help.
Yeah, well, I think that it's important to say that advocacy is a big part of our planetary health or climate change response. We need to act, and we need to talk. What we are trying to do in MSF, as we always do, is we are trying to, by our action, give a voice to the people affected and actually show consequences that we are seeing in the field. So an advocacy campaign is not out of the picture, of course not, but we think that we need to invest first in action, and then at the same time building up what are the messages and what are the advocacy that we can do.
Okay, we have a comment from Amin Khan. I am from Bangladesh. I support Doctors Without Border because they always are working for the Rohingya response. Thank you, Doctors Without Borders. And we got a lot of love messages to Doctors Without Borders in the chat as well. So I think people really appreciating the efforts you are doing, and by this, Monica, I would like you to close the session with a message about how do you think, or what do you think about Doctors Without Border missions after 50 years of humanitarian action?
I think this is not going to come to a surprise with anyone, but I have torn feelings. I would have loved that we will not exist in today. that's a failure for humanity, that Doctors Without Borders still is relevant and has a work. So with that heavy heart, I think that I'm proud to be an organization that keep on trying to assist population in distress, that they are very much willing to go that extra mile to do what is the right thing, or what we consider is the right thing, that is able to evolve, mature, and is willing to get out of their way to be much more in partnership with the populations we are trying to assist, and not considering them as the victims that require help, but as part of the solution and their own, and giving them agency. And that MSF is the people. So thank you for the lovely messages. We are nothing if we don't have the population, the people that support us, either working with us, either giving us resources, or just spreading the message, or even challenging us. So I think that's it's very rewarding to see that people after 50 years still believe in MSF social mission. But at the same time, it's sad for us still have to be here supporting people in distress.
And I think now we have come to the end of our session, and now we would like to thank Dr. Monica Rull, the Medical Director of Doctors Without Borders Switzerland Operational Section. Thank you, Dr. Monica, for being with us today.
Thank you very much for the invitation.
Thank you all for watching us, and please follow the page to know about the coming conversations. And thank you, and hope you enjoyed the conversation just like we did. See you.
Bye. Thank you.